Welcome to Smokefree Housing, how to adopt, implement, and enforce a smoke-free policy. No matter the size of your property, property owners and managers can successfully carry out a smoke-free policy. Smoke-free policies create healthier environment for residents, reduce turnover costs, reduce risk of fire, and appeal to tenants. The staff at the American Lung Association is here to help you every step of the way. The American Lung Association is the leading organization working to save lives by improving lung health and preventing lung disease through research, education, and advocacy. This presentation is presented by the American Lung Association in Oklahoma on behalf of the Oklahoma State Health Department of Health to assist with implementation of smoke-free policy in multi-unit housing complexes. Upon the end of this presentation, you should be able to understand the benefits of adopting a smoke-free policy, understand the effects of secondhand and third-hand smoke, know how to adopt, implement, and enforce a smoke-free policy, know about local cessation resources that are available for your residents and employee and staff. Reasons to go smoke-free. Market demand is high for smoke-free housing. Most renters prefer a smoke-free housing, and some are willing to pay more and move to avoid secondhand smoke. In a recent survey among American adults showed that 81.7% agrees that apartments should provide the option of 100% smoke-free building. 2 out of 4 Oklahoma smokers agreed. Secondhand smoke exposure poses serious health threats to children and adults. Smoke-free policies prevent damage to flooring, drapery, and appliances. Your property may qualify for reduced property casualty insurance rates. Every person living in multi-unit housing deserves to breathe smoke-free air. Did you know secondhand smoke contains over 7,000 chemicals and at least 70 are known toxins? According to the U.S. Surgeon General, there is no risk-free level of secondhand smoke exposure. Third-hand smoke can combine airborne particles and form carcinogen, damage DNA, and lead to cancer. Non-smokers are up to 30% more likely to develop lung cancer if exposed to secondhand smoke, and 10 of thousands of people die each year from secondhand smoke-related illness in the United States. Secondhand smoke is the combination of smoke from the burning end of a cigarette and the smoke breathed out by a smoker. When a person smokes near you, you can be exposed to secondhand smoke. Each year, an estimate of 28 million multi-unit housing residents are exposed to secondhand smoke in their home or apartment that come from somewhere else in their building, like a nearby apartment. Secondhand smoke can travel into an apartment from other apartments and common areas through doorways, cracks in wall, electrical lines, ventilation system, and plumbing. Opening windows and using fans does not completely remove secondhand smoke. Also, heating, air conditioning, and ventilating systems cannot eliminate exposure to secondhand smoke. In fact, these systems can distribute secondhand smoke throughout a building. Third-hand smoke contains cancer-causing residues from tobacco smoke that stick to surfaces such as carpets and walls. Chemicals that absorb to the surfaces eventually break down and desorb back in the air. Residues can continue to damage property even after the smoker moves out and can be picked up when someone touches surfaces. Here's a picture of an example of a third-hand smoke apartment. By adopting a smoke-free policy in multi-unit homes, it can improve health and save money in the United States. 43 million in costs from cleaning apartments where people have smoke, and 16 million in costs from fires caused by smoking. Smoking is the leading cause of fire-related deaths. Approximately 1,000 people die every year for smoking-related fires. More than half of the deaths occur in multi-unit housing. We often don't think of smoking this way, but smoking is a fire hazard. During 2012-2016, an estimate of annual average of 18,100 reported homes structured fires that were started by smoking. There are many steps that are included in adopting a smoke-free policy, so let's talk about them. There are many things to consider when adopting a smoke-free policy. Who should your smoke-free policy apply to? It should be applied to everyone equally, such as staff, tenants, and visitors. What products to include in your smoke-free policy? Prohibited tobacco products and e-cigarettes. Prohibited tobacco products are cigars, cigarettes, vaporizers, hookah, or pipe containing tobacco or a tobacco product. Where should your smoke-free policy be? All indoor areas and unit and common areas? All outdoor areas within 25 feet from buildings and entranceways? Designated outdoor area, or the entire property? When should you adopt your smoke-free policy? Whenever you do decide, just make sure that you provide your residents with enough notice and also involve your resident with the process to create buy-in. Why should you adopt a smoke-free policy? To reduce second-hand and third-hand smoke exposure. How to enforce a smoke-free policy. Use your existing enforcement procedures for other things on your property. And graduated enforcement. Graduated enforcement is a structure to help ensure better compliance with the smoke-free policy by providing multiple steps of enforcement and providing the opportunity for residents to change their behavior. Eviction should be used as a last resort. Why to include electronic smoking devices, also known as electronic nicotine delivery system. Electronic smoking devices means any device that can be used to deliver an aerosol solution that may or may not contain nicotine to the person inhaling from the device, including but not limited to e-cigarettes, e-cigar, e-pipe, mod, vape pen, or e-hookah. The risk of electronic smoking devices. In 2016, the Surgeon General concluded that second emission contained nicotine particles, a chemical linked to serious lung disease, organic compounds such as benzene, which is found in car exhaust, and heavy metals. E-cigarettes have been found to start fires while the device is charging. It is very important to involve your residents in the process of adopting a smoke-free policy to create buy-in, such as sending out a survey. The American Lung Association offers a cover letter template and sample survey that can assist you with this process. Within the survey, make sure you outline features of the new policy and invite feedback from your residents. Smoke-free policies do not violate resident privacy rights or the American with Disability Act requirements. Do not discriminate against residents who smoke. Smoke-free policies are about where people smoke, not about whether they smoke. Now that we have discussed about how to adopt a smoke-free policy, it is time to move to the next step, implementing a smoke-free policy. The first step of implementing a smoke-free policy is to make a plan. Think about important aspects of your new policy and get them on paper. Develop a detailed strategy for going smoke-free. Should all your property be non-smoking or only certain buildings? And what is your timetable to implement the smoke-free policy? Get everyone together, employees, tenant, and management. Make sure to have a clear, open communication. It will make the transition smoother. Explain your new policies, reason for making the change, and how the new policy will benefit them. Communicate with tenants. Formally notify your tenants in writing. Tell them about the change, when it will take effect, and what the policy covers. According to the landlord-tenant law, residents need at least 30 days notice regarding the policy change. Update your lease to include language about the new smoke-free policy. All new leases should include no smoking language. Display friendly but firm signage throughout your property, informing residents and visitors of the rules and your expectation. Here are some examples of some decals and signage that will be available to you at no cost. When drafting your policy, it is important to include language that fits the rules that you want to be followed on your property. The American Lung Association and the Oklahoma State Department of Health can provide policy writing and technical assistance. The American Lung Association can provide sample policies for your property. Here is an example of a smoke-free policy with a 25 feet barrier from any entrances or buildings. Here is a smoke-free policy with the designated area. Here is a smoke-free policy where the whole property is smoke-free. The American Lung Association has an Oklahoma Smoke-Free Housing Directory and Recognition Program. It is a comprehensive listing of all multi-unit properties in the state of Oklahoma that have adopted a smoke-free policy. The Directory and Recognition Program was established in 2020 to acknowledge properties that have adopted a smoke-free policy and encourage additional property owners to adopt a smoke-free policy and to assist tenants in looking for a smoke-free property. Properties listed on the directory receive a certificate of recognition from the American Lung Association. Their name is also listed on the Smoke-Free Housing Directory online. The recognition level is based on the type of smoke-free policy the property has adopted. There are 3 levels of recognition available: gold, silver, and bronze. In order to receive the gold recognition, 100% of resident lease agreements include a smoke-free policy, making all units and common areas smoke-free, and 100% of the property grounds are smoke-free. Silver recognition. 100% of resident lease agreement includes smoke-free policy, making all units and common areas smoke-free, and smoking prohibited on property grounds within 25 feet of buildings. Lastly, bronze recognition. 100% of residence lease agreements include smoke-free policy, making all units and common area smoke-free, and smoking is allowed at a designated area. Or at least one building on the property are smoke-free, making all units and common areas smoke-free, and smoking prohibited within 25 feet of building. To be considered for a certificate of recognition, the property manager or owner must submit a completed Oklahoma Smoke-Free Housing Directory consideration form and a copy of lease agreement or addendum that states smoke-free policy. Use the link below if you are interested in being added to the Smoke-Free Housing Directory. Now, let's talk about how to enforce a smoke-free policy. To enforce a smoke-free policy, it is best to use the compliance-focused approach, which is educating prior and throughout implementation by sharing information about the benefits of a smoke-free policy, share resources about secondhand and third-hand smoke, and utilize the free resources the American Lung Association has to offer. Have clear communication with staff and residents by holding meetings to let them know about the smoke-free policy, and post signage throughout your property to remind staff, residents, and visitors about the smoke-free policy. Utilize graduated enforcement, which is in a structure to help ensure better compliance with a smoke-free policy by providing multiple steps for enforcement and providing the opportunity for residents to change their behavior. Eviction should be used as a last resort, and also have cessation resources available for the staff and tenants to manage their cravings, reduce use, or ready to quit if they are ready. Utilize resident enforcement, such as compliant-driven enforcement process. Create and reinforce a private right of action for residents. Smoke-free multi-unit housing ordinance violation, and a private nuisance action. Work with residents to identify and, if possible, address barriers to compliance. Provide information about cessation resources, and distribute policy reminders to all residents when there are reports of smoking violations. Let residents know how to report violations and what to expect from the enforcement process. Residents are often the eyes and ears of the enforcement efforts. Here are two cessation resources that is available for your staff and residents. The American Lung Association Freedom from Smoking program is for tobacco users who are ready to quit. We have multiple platforms available. The Oklahoma Tobacco Helpline is free and available 24/7. They provide tools and support to help you quit tobacco your own way. Here are some lists of resources that is available to you to assist with smoke-free housing. The American Lung Association Smoke-Free Policy and Multi-Unit Housing Step for Success Training, a free comprehensive toolkit that includes many sample documents and policies, free signage for all buildings and properties, free listing on the Smoke-Free Housing Directory, and tobacco cessation resources. The American Lung Association is here to help you no matter what stage you are at with smoke-free housing, or add you to the smoke-free housing directory if you have a current policy in place. Adopting, implementing, and enforcing a smoke-free policy is easy. We are here to help with numerous free resources available. Contact us today to get more information or to get started. You can contact us with information provided in this slide.